Okay, so we are live. All right. So tonight we have Evelyn with us. Evelyn is a occupational therapist.
Yeah.
Turned into what do you call yourself?
Well, I'll call myself manual therapist, but I'm a certified lymphedema therapist to be official. But I also do a lot of visceral manipulations and neural manipulations, so I can call myself a manual therapist, to be more holistic.
Okay.
Yeah.
Yeah. So a little bit of background then. I first met Evelyn last year, I think, after post surgery. I remember it was after my shoulder surgery, and then. That time, Lydia is my physio, also very good, very competent. Yeah. But she couldn't fix this problem that's up my neck. And it was affecting my sleep because every night I sleep, no matter what pillow I choose, no matter how I sleep, how I turn my head around, position myself, I'll still wake up with neck pain. And so Lydia said look, I don't exactly know, but you can go see Evelyn. And I saw her the first time. I didn't know what's going on because I never heard of this before. Yeah. So I remember you did some drainage.
Not really drainage, it's a fascia because when I remember when I first saw you, you are one of the few clients that has problem with the neck fascia, the tension in your deep neck and superficial fascia system. And I remember you also have a liver problem.
Right, yeah.
Your first organs that shows up is a liver.
Yeah.
Other than your neck is your liver.
Yeah. And after that night, after that session, right, I went home, slept like a baby, woke up, problem gone. I was like, something different here. Because usually, maybe you are better to tell the difference between what the physio do and what you do and what's the difference.
But let's take a step back. For somebody like me who hasn't been exposed to any of this, right? First hand, second hand, even through somebody, right? Leading up to this podcast, I've been reading about visceral manipulation, and it's mind-boggling. I believe it, but it's also so unbelievable that it's good to be able to get it straight from you. So maybe you can tell us a little bit about what is it, what do you do, and what are you called? Just a brief background.
Wow,
I guess.
A brief background. Okay, visceral manipulation is all about the internal organs, alright? Jean-Pierre Barral, our founder of these techniques, say that 70% of the musculoskeletal systems are due to the visceral, which is our internal organs.
Right.
Because when you look at the anatomy, our stomach are slanted towards the T6. So it's really closely connected to our spine. And today I saw one lady with a cervical problem. She said that she has slipped disc on the C4, 5. But just now, when I test on her, they said, no, it's your esophagus that was so tight. It pulls your cervical forward. So you were doing the neck flexions, kyphotic slouchy. And it pulls on your spine and it changed the dynamic of your nerve that comes out from the spine. So you have neck pain and shoulder pain. So what I did was I manipulate her esophagus together with the stomach. And within one session, she can bring her neck back without effort. She can move her neck. And that's amazing. So when you say that, okay, what will physio do? When you go to the physio with a neck pain, the physio will not look at you through the internal organs, right? They will say, okay, neck pain. Oh, you cannot bend your neck. What they do is spinal manipulations. They give you hot pack. They give you test machines. They ask you to do a lot of exercise to prevent slip disc, blah, blah, blah. Stretch it up, postures, teach you how to maintain good posture. Yeah, I also asked my client to maintain good posture because I told her, what causes the tensions in your esophagus? Sometimes it's not because the esophagus wants to tighten up, because your poor posture. You sleep with a high pillow. Alright, I told her, do you sleep with high pillow? Yeah, she said yes. Because when you have tensions, you tend to hug the lesions. You want to move towards the tension to prevent the pulling, prevent the stretching.
Wait. Just hang on. What do you mean? When
someone
let's say our throat is tight.
It's tight.
Right.
So you
tend to want to
hug lesions. You want to move toward the tensions. You don't want to stretch. You find that this is uncomfortable for you.
It hurts.
Because it hurts. Out of the people wants to go into the comfort zone. So when you have problem with your liver, when you have appendicitis, what you do? You don't do this. When you have appendicitis, you will hug towards the pain, towards the lesion. That's why we say that. Jean-Pierre always asks us to go for the assessment. Look at the posture of how the patient stand And you know whether the lesion is on the right side or on the left side before you even put the hands on the skull to do the fascia assessment. You already know. Yes.
Well, so, okay, we were just talking about a physio, right? A physio would do things like that,
Things
right?
like, hot pack,
stretches,
stretching, exercise.
To, straight away kind of like troubleshoot that pain there.
Yes.
But what is it that you do that is different? So what is manipulation in your definition?
Yeah, okay. So when patients come to me with pain, I'll always say that there is pain, yeah, but that is not my concern. My concern is what causes the pain. I will hunt down the place or the organs that create the pain. So the pain can be in shoulder, but the problem that created the pain can come from the remote side, like even your pelvic floor, even your uterus. It can change the alignment of the fascia and it create the tensions that cascading up towards the shoulder. I once had a client who came to me with a right neck pain, and I was like, okay, I suspect, okay, this could be the liver, like what I found in kid, right? So right shoulder, it could be liver. But when I do the assessment, Jean-Pierre always say that, feel first, think later. Don't assume. So for that particular case, it brought me to, funny, it's not liver. So, and it brought me down to the right kidney. That's strange. I have never come across a right kidney that can create a neck pain. So the right kidney with the associate organs go down to the bladder. And once I manipulate the kidney together with the bladder, the client said that the next day said, oh, the pain's gone. I said, all right. And I went back. I looked through the anatomy book. Oh yeah, there is a close connection of the kidney, bladder, and the bladder. There's one ligament that link all the way up to the liver. That is the link. It comes down and goes back up. So this particular client has different kind of tension. So for visceral manipulation therapists, you are like, we call it Sherlock Holmes. You have to really learn how to feel the fascia, and we don't do protocol treatment. Right. There is no protocol. Our teacher always said that you are not technicians. You don't operate the TENS machine. You don't go like, okay, knee pain, you go exercise, hot pack, cold pack, that's it. Right. No, for visceral manipulation therapists, you really have to be very, very good with your anatomy and your sensory input from the hand, and you have to hunt down and you have to have a very good analysis of the problem.
So basically, we, as a manual therapist in this domain, when a client tell you that they have a pain in a certain area, you don't follow the client first.
We don't follow. In fact, we will ask not to interview the client first. So now I practice what Jean-Pierre asked us. We only ask the client after we completed our assessment.
Oh,
yes.
You are also, I guess, not biased.
Not biased because we cannot bias. Yes, But my client tell me their story, their pain story. If I listen to them, I will bias. I will try to think first. Okay, now what causes this pain? Right. So lately, I have this young girl, 10-year-old, came to me. The father brought her here. I said, okay, don't tell me why you bring her here. All right, just you sit there, write down your questions, the history of the problem, and the rest. Let me do it. So I brought the lady, the young girl, in the room, do all the assessments. So when the father came in, I said that your little girl has a lot of problem with the colon. She might have constipation issue. She might have breathing problem. And the father said that, oh my God, from 3-year-old onwards, she has had a lot of problem with the bowel. They always bring her to see a lot of specialists just to settle her bowel problem. I said, yeah, because the colon, there was one ligament that's really tight and it affects her breathing pattern. And the father said, oh, that one, I really don't know. Then I'll show her, see how she breathes. And she can't breathe properly through the left lung. And it's very strange for a young lady to have this kind of symptom. And there's no trauma to it. There's no trauma, there's no fall, nothing. Then I will tell the father, yeah, our founder said trauma can be from the fetus. When you're, as a baby, you may have trauma by prolonged positioning in your uterus. You press your head in your pelvic bone. Yes, from there. Wow. So the alignment are not right from fetus. And the delivery process, sometimes you forceps the baby out. You clip on the cranial
Right.
And that is the trauma that no one pay attention to. So the baby grow up with this kind of imbalance in the neuromeningeal system and affect the internal organs in the later stage.
Sorry, neuro what system?
Neuromeningeal, like,
Right.
the fascias, the lining that cover our spine.
Oh, I see.
Yeah, the nerve.
So because someone press it and then there's
yeah, it could be like our skull. You know, when you have a
Whoa.
first-time baby, it can happen. Or the baby has a fall during the childhood. You never know. The baby might fall on the coccyx, and then they are fine. They are mobile, but the lesions are there. That it build up slowly. Like yesterday, I saw one young boy also, like 14-year-old with back pain. Then the mother, 14, after basketball back pain, so the mother brought him here for treatment. I said, okay, now I will not use the machine for treatment. She asked me to use the radio frequency machine. I said, yeah, that one put aside first. Let me do assessment. And when I do the assessment, I said that for a 14-year-old boy, the liver is too sluggish. And I do the shoulder range assessment. The right shoulder is limited. But this one was not brought to the attention to the mother. The mother was concerned with the low back pain.
Right.
Like, yeah, low back pain. Then I asked the history. Do you happen to have fall of the coccyx? Yeah, in the coccyx? Or do you have whiplash? You know, like someone hit you. You are in the sports. Maybe someone hit you and then you have big fall. Because your liver was showing signs of trauma that's bring all the way to, and then it affects the right shoulder. And the boy said, no, I can't remember. Oh, then the mother said, yeah, you had a very bad fall once on your coccyx. You know, you slide and you hit your bum. But the boy said, I thought that was fine. I said, no, that's not fine. So I prone him and I test do the assessment on the sacrum. And it really, there's sign of distress at the coccyx bone. So we fix the coccyx bone.
Which is that last bit.
The last bit of the spine, the cauda equinal, the last nerve that comes out from the spine. That is a very powerful nerve. It affects the whole nervous system. Yeah, and I have treated a lot of clients with this coccyx dysfunction, with back pain. And one session's done. No more complaint. That's why I have been trying to urge all the local therapists, like, try to pick up visceral manipulations and don't just do the standard
what you're taught.
yeah, and SOP thing. And when I see the physio who said, oh, my client recovered after 10 sessions of physio, after 40 sessions of physio, and was like, okay, now if you pick up VM, the client might not need 10 sessions with you.
Right.
What you are doing, like sleep this. In the research already said, sleep this, even if you don't go for physio, they can recover themselves. They go back themselves. So after 14 sessions, you thought that it's because of your physio work, but somehow it could be because of initial recovery.
Yeah.
Who knows? So my ever since I practiced visceral manipulations, the result was very good. Within the maximum sessions, 6 sessions. Done everything. That'll be fine for a long time.
How do you got into this? What brought you down this path?
Curiosity. Curiosity. I specialized in stroke rehab for 24 years.
Right.
And I have a very good friend, also my mentor in Sydney. We worked together in Singapore Mount Elizabeth Hospital for quite some time. We graduated from the same university, and he's my junior. So one day, he touched base with me. He said, oh, you know what? I have been practicing this special technique for more than 10 years. And
in Australia?
In Australia.
Right.
So, and this technique bring me to another new level of treatment. I'm not doing symptom treatment. And this give me a lot of satisfaction when I can pick up a liver tumor from my client. That is when it sparks my curiosity. I said, what are you doing? Like, you can pick up liver tumor. What craps are you talking about?
Yeah.
All right. So, he said, come and join me for one course in Singapore, right? The first course I attended is in Singapore. I was really skeptical because I'm a very scientific person. I said that,
yeah, evidence-based,
who
right?
can pick up a liver tumor with bare hand? Who can ever do that? Yeah.
Which is exactly what's going through my head, right? Listening to this. It's very comforting to hear it coming from you as well.
Yeah.
Yes. So I'm very curious. So I signed up for this course, the first level, and it really blew my mind. Not really blew my mind, because I don't learn anything during the first course, really, because the technique was really out of my expectations. Like, you touch your head, what are you supposed to feel? I can't feel anything. And during the course, we will train how to palpate the liver, how to locate the liver and the cecum and all the few organs that is more hardy to palpate in the first level.
What do you mean palpate? Like just
like you really have to locate the liver,
Right.
how to go into the liver and
Grab it.
and then do the
okay.
manipulations on it. That's the
Right.
first level. First level, they teach us how to touch all these organs, which is hardy. You won't hurt it by mistake.
Okay.
All right. So
you can just go in.
yeah,
and
that's why
like,
Jean-Pierre Barrault, Jean-Pierre Barrault designed the course very well for a new learner like us. Yeah, even if the colon, if you hurt it, you press on it, it won't hurt. It won't change your shape. Yeah. The worst thing is that there's no result. There's no treatment result. That's
Okay.
all.
Okay.
So when level 2, they put in more organs like the pancreas, the spleen, where it's more fragile. They expect you to be able to do better palpations, better technique, so that you can go to level 2. Yeah, and in level 2, level 3, my hands get more and more sensitive and gets lighter and lighter, because in level 1, I remember my mentor was yelling at one student, "Stop poking into my liver." Stop poking, because as a therapist, we are very hard. I am a stroke therapist, right? I have to carry patients. I really have to use a lot of
Right.
force, grab them, do joint manipulations, do stretching. It's very hard.
For
It's
people
really
who are
very
not
forceful.
really mobile and
Yes,
maybe they can't feel a lot of things.
And like general clients also think a therapy session has to be hard, painful to be effective.
Yeah. Yeah.
Right?
That's what we think. Like
That's
massage
why
also
we
is
go
the
to the
same
massage,
thing.
yeah.
Yeah.
Yes, the harder the better.
The harder the better.
But in visceral manipulations, it's the lighter the better. You have to be precise. Jean-Pierre said, precise is the word that helps us to get to the point, to be effective. Not how hard you are, not how quick you are. So the precision. So we have to look at the anatomy book every day to make sure that we are precise.
So you just want to press it hard enough at the
We have to
lesion
appreciate,
point or- okay.
we have to appreciate, follow the fascia system. We really have to, we call it listening. Listening through the hand, like feel the tension, feel what the organ's trying to tell you. Yeah. And to appreciate it. And we do a lot of induction. We don't force it out the way we really have to, because we don't want to create a fight and flight system, defense system for our body.
You don't need to go
Because-
into tension.
Yes, you don't want. So our body has a memory. So like joint stiffness, the client came to me first session, I give him a lot of pain by doing manipulation, stretch joint. The next session they come to me, the brain already starts tensing up. You don't have to touch the joint. They already try to guard, dissipate the pain,
Yeah.
and so that is not what we want. That's not what we want. So yeah, after 11 courses in Jean-Pierre, I think I appreciate more from very skeptical therapists to not believing it. I start to believe because I see a lot of, even practicing on my parents or my family member. I before I set up the clinic, I practiced a lot on my own family members, and I see a lot of result. And the result was like, is it psychological or is it really that they have this response?
Right.
Yeah,
But
could it be like a
Yeah,
self-prophecy,
the self-
right?
yeah,
Where you
self-prophecy,
say
yes.
there's something wrong with your stomach, and then they start
They start.
feeling better about it, and then they're okay.
Placebo lah,
Yeah,
basically.
placebo.
Yeah.
Yeah. But no, because my kids come to me, Mom, I have tummy ache. Okay, I'll do something. And the next day, because kids, they don't lie, they respond. Like even my own mother, when she has low back pain, the sciatica pain, the first thing she think was to have a painkiller, the jab. She wants to admit to hospital to have the painkiller jab. I said, no, let me help you. At first, she doesn't believe. She went to the hospital, admitted herself, get one jab. And that night, I said that, okay, now don't have another second jab. Let me manipulate you. And the lesion was her duodenum, right? So I manipulated her duodenum in the hospital bed. And the next day, she discharged without the second jab. Yeah, 1 month later, pain-free. And my mom told me, oh, Loy, that doctor is pretty good. The painkiller, the one jab can last so long. I said, Mom, that is crap. Painkiller don't last 24 hours. And the doctor, remember the doctors tried to give you another second jab. And I said, no need. You're painless now. You're pain-free now. So we discharge. Did you forget that night I manipulate your duodenum in the bed? I said, oh, that's it? Yeah, that's it. So after that, my mom will come to me whenever she feels discomfort. So that is the elderly perceptions. So if I can change my mom's perceptions, and I can slowly try to bring it to the rest of the young people. Yeah.
That's extremely interesting.
It's extremely, yeah.
It's like really good to be like, in your family, I guess.
Treating your own parents is tough. It's difficult. It's very difficult. Treating your own parents. And initially my mom disagreed. I spent so much. I literally spent a lot of money on the courses. She said that
in Singapore,
we have to go to Taiwan. We follow the schedule. We really have to see which country hosts the course, hosts the level that I want. Like VM 1, 2, 3, 4. Like sometimes Singapore have VM 1, 2. I need level 3. I have to look through the website to find which country are hosting level 3 and level 4. So we travel a lot. So my mom said that, now, Loy, go ahead. Complete the course because it really works. It works so well on everyone. I have a young boy who came to me with varicocele on the scrotum. The left varicocele was swollen, and varicocele is a varicose vein.
Right.
Yep, in the left side of the scrotum.
Okay.
It will affect the health of the scrotum. So this little boy, he's a young man, like 20-year-old young man, came to me. I said that, you know what? He came to me with acute low back pain. Not really with varicocele. Yeah, wow, it's acute low back pain. But I picked up varicose vein because it was really funny. The acute low back pain on the left side.
Right.
And it brought me to the left kidney. And the left kidney, instead of staying placed high up at above the umbilicus, it was ptosis. It came all the way down below the umbilicus.
Means the kidney from a higher position
went down. We call it ptosis. Right. Yeah, drop down.
Right.
And I told the boy, this kind of kidney will cause the poor blood flow to the testis, to the urogenital organs on your left side.
Right.
Do you happen to have problem? And he said, I have varicocele.
He knows
he has because he has problem with the swollen scrotum. And I said that.
All right. So you feel uncomfortable, probably.
Always uncomfortable. I said, because the kidney was ptosis, it dragged the veins system and it blocked the blood flow from from the scrotum up to the kidney because the urogenital blood flow has to go into the left kidney. With this kind of positions, it twisted all the blood vessels and it impeded the normal flow of the blood. So in the left kidney came down, it pressed on the nerve, femoral nerve, on the psoas muscles. That's why he has acute low back pain. So by manipulating the kidney back to the original positions, after a few months, his back is gone. Right. Back pain gone, definitely. But I follow up with him. How about your swelling? Varicocele. He says, swelling is not bad. I can't change the shape of the varicose vein because what we do is improve the blood flow. Right, we can't recover the twisted vein.
Right.
But I changed the swelling. It was not swollen anymore. Like it was very comfortable. To him, the discomfort is gone. Minimized.
Right.
The condition is still there. But because the kidney are in place, the blood flow will recover better. And the swelling will more or less reduce.
Hopefully
still there.
Over time will go away.
I can't say that we can heal it. The structures change just is already there, but we manage the symptom. Yeah, we give them a quality of life, right? Better.
But it's strange. I feel bad for the boy. Like he went in for a back pain, and then turns out it's something wrong with his balls.
It will.
Was his kidney.
Yeah.
But, so I guess what you have to do is usually it's always organ based.
It's all visceral manipulation is about organs. And the organs can be from, it's the thorax, the pleural, the lung, the heart, the pericardium, every organ in your body.
You mentioned duodenum just now. I remember learning this in biology, but I forgot completely.
I know.
What is it again? The duodenum?
The duodenum is the first part of the intestine that attached with the stomach.
Oh,
Yeah,
okay,
the stomach,
okay.
the stomach come
It's like
out
a
of
little
the-
leaf structure.
It's a kind of C shape, around the umbilicals.
Okay.
That's why sometimes you have a duodenum ulcers, you have stomach ulcers. Yeah, different. My anatomy improved so much after I attended the course. If I like 3 years ago, I can't even palpate the cecum. I don't even know where is the liver, the topography of the liver. But now I when I look at you, I can see everything. I can see through your organs. I'm like, because it's like to me it's become like 3D.
Amazing.
Yeah.
Amazing.
It's amazing. But of course, practice makes perfect. You really have to practice it every day.
So
Yes.
is this course for anybody with a passion for learning, or do you have to like certain background?
Certain background.
Certain
Jean-Pierre, lately we have received an email from Jean-Pierre saying that he's concerned that some country they offer to non-medical practitioners for the courses, and he is really concerned. He doesn't want anyone to come in the course.
Because the quality might be affected.
Yes,
then.
quality might be affected. And then who will lose? The patients, the
Right.
client. Yeah. So in Malaysia, I am the organizer for this course. I
Right.
will only ask those manual therapists, especially physio, chiro, or anyone like Rolfers who has an anatomy background, who is dealing with a lot of manual work, to come and join us. I have a client who wants to come, but I said, no, you are not a medical background. We cannot take you in the course. Yeah, even though you said that you want to learn just for your own family members, I said it's quite tough. Because you have to partner with a medical staff, right? In the course, you have to practice on the manipulations and all this. It will affect.
When you say medical background, they don't necessarily have to be doctors.
No, therapists, we target more on the therapists. When I bring in the course, I have the physio in mind, because our teachers say that this is a missing link in the rehab world.
Right.
Physio always look at the skeletal system. Joint, muscles, spine. Yeah. But this is a missing link. If you put in the organs, you can appreciate what causes the stiffness in your spine. It's not that the spine wants to fuse up. There's a lot of pulling from the front. I have a young girl who has scoliosis, right? When I check the it's not the bone that attract me. It's her pelvis, it's her uterus, and I checked the system. Uterus level was L45, and then she has stomach problem. I asked her, whether you have a gastric problem? She said, yeah, because the biggest place was the L1, where the stomach, pylorus came out, and she has massive menstruation pain and gastric pain. And that's the level that her spine twists. So I said, yeah, by releasing the pulling from internal organs, they can continue with the exercise-based therapy. They can correct their muscles balance and then spine. So I am asking the therapist to look at this level first before you ask the client to do the exercise. It will be more helpful for the client. Instead of fighting with the pulling.
Right away,
yes.
and then like when it's more relaxed, you can rebuild the muscle correctly.
Yeah.
to
I have another 19-year-old boy came to me with a very bad scoliosis. Alright, spasm in the upper back. So the friend who referred him to me was a friend in visceral manipulation course in Singapore. So this is his nephew. So I was like, okay, can you help me to look at my nephew for this severe scoliosis? I said, yeah, let me handle him. Yeah, you know what? He was a reverse C at the thorax level. And when I do the listening, the GL, it brought me to the right lung. And the right lung was so tight, it pulls the spine to the right side. That's why the boy was doing a lot of the spine.
So it's leaning this way.
Leaning this way, yeah. And the muscles was really tense on the right upper thorax.
Is there a reason why though? Like why specifically like?
Yeah, sometimes it's like lung infections.
Right.
Yeah, it can cause the pleural to get adhered. The sliding or the posture. Sometimes it compress the lung, and then when all our organs have a sliding surface, if you stop sliding, they will adhere. So once they adhere, they will pull. They limit the normal movement of the organs.
Right.
So, and then this build up slowly. So it doesn't happen overnight. If there's no trauma, right, it doesn't happen overnight. You always have a back history. You can go back to the long time ago where the childhood, you might have asthma, might have lung infections when he was a young kid. And this was, we would say, okay, now after infections, you thought that nothing wrong, right?
Yeah.
But the tissues have memory. The tissue is still not healing. Yeah, the infection might be gone, but the tissues is there. It heal, and it slowly affect how the lung move.
When you say the tissue has memory,
Yeah,
you
all the
mean-
tissues, man.
I mean, is it like, they remember that they're not supposed to grow this way, or is it something more like evolution where
No,
over time they know that if this happens, it hurts, so I'm not going to grow this way, or
It will, but all our embryo, when we look at the embryo, it grows. Our tissues grow from the central, grow out. So all our organs are moving towards the central and move out. We call it expel and spill. These are the memory of our cells. It has go back to the original, to the embryo stage, and it goes out. So when we do the assessment, we assess how each organs move. If any organs that doesn't move according to the rate or to the axis of movement, we say that these organs are dysfunctional.
So
That's why.
So, for example, if my lungs is sitting right here, right?
Yeah.
Close to my chest, so it rotates in. and rotates out.
Yes, the lung have to rotate
Right.
this way. Right? Each lobe will move differently. They have their own
Axis.
plane of axis. Right? The lower lobe they move diagonally, and the upper lobe
They
vertically.
move whether I actively draw
Breathing,
deep breath
yes, no,
or
it doesn't matter. We call it motility. The organ itself is moving. The organ.
Ah.
Yes. The organ itself is moving. It doesn't move according to the breathing, but it is, even if you stop breathing,
Right.
it's still moving according to the
So that's
we call
the
it
memory
motility,
since like birth. and-
birth, yes.
Okay.
And when we talk about the memory means that, you see, when you have vaccine, right?
Mm.
Your body cells remember, the T cells remember the virus that you introduce to the body. So they
Yeah.
remember.
Yeah, so they produce
So,
the
yeah,
antibody.
yes. This is part of the example where our body have the memory.
I think it's crazy
Ah.
because we tend to think of memory as the things that we learn and retain and then we recall.
and it's a brain.
Yeah,
And
and
it's
it's
a
a
brain
brain thing. It's not a body
Yes.
thing.
Yeah.
Yeah. So because I met you again a couple weeks back only actually. Yeah.
Couple weeks back, yeah.
Yeah. And when she told me about your body has memories, the memory is stored in the cell, I was like, wait a minute. In my body?
Yeah.
Yeah, and it's very fascinating and but how is it that you go like how can you explain a bit like how like you put your like usually you start the treatment by putting by watching the posture and then you put a
check
hand
the range
on
of
the
movement, yes.
on the
Put
head,
on the
like-
head, try to look at the tension
Right.
system, where the body hug.
yeah so
where your body leans to.
so by putting your hand on the head, am I right to say that you're trying to find out which organ is like turning a bit weirdly?
Yeah. No, see, our body hug the lesions. When we
Right.
put the hands on the head, right, we are feeling the fascia system to where my hands was attracted to. Right? If you have stomach problem, we don't see your body leaning like that, but we will feel a pull internally towards your stomach.
So it's like a little tension, is it?
It's
like
a tension.
pop, like that?
We might not see you leaning towards it,
Right.
but we will feel it through our hands, to that part that your body is trying to hug. Right?
Right.
And then we do the range of motions, like we have a few tests to confirm. It's not only the head touching. On the head touching, we have to do a local listening. We have to do a lot of tests to confirm that this is the organ. This is it that we need to deal with today. Right?
And I hear the word manual therapy, right? Why can't, I'm sure there's a machine that can do this.
There
Like
is
MRI or something.
or MRI, they are still image, right? They are still image. They can't tell you what's wrong. Like even if you have stomach disorder, there's gastroesophageal problem, right? We can detect whether you have gastric reflux or not by feeling the tensions, right? There is one sign that they tell me when you have a tight tensions that pulls my hands up to the xiphoid, to the cardiac regions, and there's a sign.
So there's no
There's
machine right now to say like
no machine. Even if you do the endoscopy, what you can see is the inner lining of the stomach, but you can't see the real picture of how the stomach move.
right.
Like I have client who come to me with left neck pain. She came to me, it's a young girl. She said, I have neck pain. It's very uncomfortable. Right? Okay. But when I do the assessment,
He's feeling it.
when I do the assessment, I found that, hey, your stomach is not moving at all. your stomach is quiet. We call it frozen stomach. And she's like,
Frozen stomach.
Yes, frozen stomach. We call it any organs that is not moving.
Not moving at all.
Yeah, we call it frozen. So I do the technique on the stomach. That session is just stomach, right? She went back 1 week or 2 weeks. I asked her to come back for a review 2 weeks time. Came back. She said, Evelyn, my pain totally gone. Not only gone, for the first time in my how many years in my life, I start hearing my stomach squishy, the sound. And my stomach is alive. I said, yeah, your stomach is now digesting food properly. And before that, she used to have bloated tummy, a lot of air. She thought it was fat. But I said that no. I said, you know what? After your manipulations, for that 2 weeks, I keep farting. And my stomach was like grinding and I can hear my stomach moving. I said, my stomach is there.
Huh.
Yeah, and ever since then, she said that the tummy flattened and she has no more neck pain, and she said that she eat well, she digests food very well. So I said that there is side effect of our manipulations. We not only manage your pain, but we bring back the wellness of your body, the organs. So I have a lot of feedback, like came to me with back pain, but after that they went back, they said, oh, my poo, my toileting habits improve. Yeah, because your system functions.
Which may seem like completely unrelated things for us.
So we
don't know really about this whole connectivity of the
we don't
body,
know.
right?
Well, I kind of experienced it a couple of sessions. So I found an appreciation. So when I was speaking to...
You fart a lot.
No, but it's not his dysfunction.
Yeah,
No.
I sleep way better. And like I think previously you talk about stress, and this is you did this around my body. Like,
oh, that's the level we call manual thermal evaluation. It's my latest course.
Right.
I came back last month, November. Yeah, this is my latest course. Level
Sydney,
5,
right?
Sydney. Yeah. Manual thermal evaluations.
Right. What is it?
Through this one, this is another tools in my assessment. We, other than the physical test, this is we pick up emotional problem.
Right. So this is
we
very
pick up the slightest change of heat in your organs that emit from the dysfunction organs. When we do the 10 cm scan, right, our hands will be drawn to an area where it's abnormally hotter or sometimes it's more dense. Because our sensory are different.
But this is a non-contact test.
Non-contact test. So we are doing this, and I really appreciate this technique because with kid, I pick up that there's an emotional link of this gallbladder. Because last time he came to me, it's always very physical. I can only help him through the physical way of, but doing the physical doesn't help 100% if there's an emotional link to the brain. The brain still remember the pain, still remember the emotion. So once he's tense up, the brain will start sending signal to that organs and it will create a symptom again, the same symptom. So when we have the recurrent symptom that cannot be solved through the manipulations, it is helpful to do the manual thermal evaluation. So all my clients come to me, I will put in all this assessment just to see if they have this emotional link that I need to help them with, so that they don't have to suffer the same symptom anymore.
Right. So I'd like to share a bit of my experience, right?
Yeah.
So it's a bit, because I haven't seen Evelyn for a good few months. Things has been well.
Yeah, things
for my body. I was like, okay, I don't need this. I can just relax and everything. And then I went to see you. I was lying on the bench, right? And then she started doing this. I thought like, dude, this is like some Reiki, freaky dicky stuff. And then like,
she doing it? Just
just scan.
She's just scanning, like just basically just exactly what I'm doing. Like she's just scanning for heat, right?
Yes, for abnormal
and then she pointed to my gallbladder, and I was like, okay, I don't really feel it, but when she pressed, I was like, oh, it really feels really, really sore.
Yes,
it's like when someone massages you on your shoulder, and then you're like, oh, that sour feeling. That basam, bro. So like I felt it there.
Because it's very refreshing. Yeah, gallbladder are covered by a lot of nerve.
Yeah, and it's weird because the next part is even freakier. She literally had me lie down.
Close my eyes.
Close my eye. One hand on the bottom of my scalp, my head here, and then another on my scalp. And you were asking me questions.
Yes.
Without saying anything.
Without saying
Now,
anything.
how does
We were
that
doing
work?
the brain dialogue. This is part of the, we call it emotional.
asking you questions.
No,
without
this is
saying
a
anything?
part of the. In level 6, I'll be better, but this level 5 is just introductions to the emotional release.
So it's called brain dialogue.
We call it brain dialogue.
Right.
So we are asking the brain tissues. We have we call parietal emotional lobe on our right side. That's what Jean-Pierre found. A lot of our emotional issues are stored in this area.
The right hemisphere of the brain.
The right hemisphere, the parietal hemisphere, and the frontal near this one. So when we pick up, there is emotional link of this organ with the brain. We will use this technique. Not everyone needs the technique. Not everyone needs.
So you pick up the
emotional part
from
of
the heat.
Yeah, from the heat.
Right.
But at this 10 cm is more functional. If this organ push me up to about 30 cm and I still feel the energy
you feel the heat.
Yes.
Oh, okay.
It's like kind of like we call magnetic field. It's more like a magnetic field.
I want to get into that a bit more later.
Yeah.
Just finish
Right.
that
So
first.
and
Brain dialogue first,
and I said that okay, kid, you do need this technique because you have emotional link to the organ, brain and organ. I need to release it so that you don't suffer from this organ so much when you are tense.
Right.
And then we do the brain dialogue. There are process. There are certain way to do it lah.
Right.
Yeah, like do landing, blah blah blah.
But you don't
And
say anything.
We don't say anything.
You don't say anything.
We don't say that. We are asking the brain through the hand. And the brain tissues will answer us through the close-ending questions like yes or no. We cannot answer, how old are you? We can't. We will say like, okay, now is this a 10-year-old? It's a close-ending questions. But when there's a yes, my hands will be drawn into the brain tissues. And if it's no, it'll push my hands out. That's how we get into... Yes. I know. During the course, this is I tell you, I was also kind of freaking out. I thought, what? But it works. It really works. Before I attend this level 5, I always question my mentor. How can you pick up? Because 2 years back, before I organized a course in Malaysia, he came here to do a demo for the local therapists and show people what is called this VM. And there's one old lady, our demo case, she came in for the treatment. I said, okay, now. And then he was doing the treatment, blah, blah, blah. And then he told the lady, you don't have physical problem. Whatever you have are more emotional. And 5 years ago, there are 2 men in your life that cause the symptom.
Whoa.
I was like,
2 men.
and then, he can pick up 2 men. And like, 5 years ago, and the problem is, how do you know 5 years ago? How can you ask? That was 2 years ago, and I keep, how can you do this? What kind of technique is this? I said, you will reach that level. He asked me, you will reach that level. So, and then when the daughter, and when the daughter of this old lady told me, my goodness, 5 years ago, my mom really have problem with my dad because my dad passed away and my youngest brother, only brother, divorced. So ever since then, my mom always complained of heart problem, headache, whole body ache. And didn't know that it was due to the emotional issue and not the physical issue because they had been bringing her to see a lot of doctors. There's nothing. Physically, she's
So she do all the
fine.
scan, everything.
Yeah,
but nothing-
it's just that the old lady always complained pain, not comfortable. Yeah. But it was emotional issue. So now, after I took the VM5, then I realized, oh, dude, I can do the same thing. I can. When I finish my level 6, I
So
could
when
be
are you
as good.
doing VM6? I want to
Yeah,
come
I
back
will.
to
Yeah,
that for another
2020.
session.
2020. Yeah, but that was. I signed up for the course already.
So,
It's a rare level.
One question, VM5 now, I guess, are
It's
a lot
only-
more sensitive.
It's a lot more sensitive. Yes.
Does that affect any your daily life? Do you feel that?
No. I'm still very grounded.
No, I mean, do you feel that since you have done VM5 now, you are more sensitive to heat, for example? So if you hold
no,
a hot
because
cup of coffee, it is
no. It's no. There's a no.
coffee.
It's just the sensory part. It's like when I use my hand, my dominant hand, this dominant hand can pick up faster and better.
Right.
So I can even do the scanning now on you. So, it's just a rough assessment because this MTE is for us to zoom in the level and then check whether this is physical lesions or emotional lesions. And we have to go in to do the general listening and local listening to confirm again. So this and other tools. It's not.
So there's like a few things.
Yeah, it's
it's
more. Yeah. So give us more precisions because what we want is we have to be precise.
Right.
Right. And our goal is to cure you or to settle all your problem within one session. That's my goal. But of course, if I can settle your session within your problem within 3 sessions, it's still better than 10, 15 sessions that, never ending kind of treatment. So that is my goal. I really hope I can reach this level when my guru reach.
Right.
I'm coming to see you soon.
No.
Here's the crazy thing. She identified I had some anxiety issue way back to 1 year old.
1 year old.
Now I was
When you were 1 year old.
when I was
I was asking. I was really strange. I was like, can this guy remember?
Evidently not. Evidently not. But I was like, that time I was having a lot of stress in my life, and I was like, I was also looking back to certain reasons why I cannot move forward when I make decisions. Like, why is it so difficult for me? Why do I have so much anxiety when I want to take the next step? And I realized my childhood, I have certain issues with my parents where even though it's been a long time, it's still there. It's still stuck. And there's that trauma there that's holding me back because the fear comes from then, not from now. Now I'm fine. So it's quite weird.
Yes.
Yeah. So when she says 1 year old, I'm like, oh, holy shit. Because I remember my mom said when I was young, I cried non-stop, bro.
Yeah.
I cried non-stop. My mom go to the market without me. I'm just, afraid to be alone.
Yeah.
So I was like, holy
because
shit.
when I asked him this question after I finished the treatment, I was like, what I asked the brain was like, okay, is this 10 year old? Is it below 10 year old? And then it brought me all the way to 1 year. I said, oh, strange, 1 year. Okay, now. And then 1 year, what can the baby do 1 year? And I asked the brain, are you alone? And the brain said, yes. Are you in the dark room? Yes. Are you crying? Yes. Are you scared? Yes. That's when all this yes, quickly connect my hands to the gallbladder. And the treatment start. So what we want is that the connection from brain cells to the organs that we pick up, right? And when the connection start, that was like, okay, now we have to wait for the moment when all this disperse, right? The connection soon. Then we complete the treatment. That's when I asked him, do you remember that 1 year old, this. And then he was like, I don't know. Yeah, I just said, okay, this is what I brought up. And he had to go back and digest all this. He has to face this and digest. And I sent him the reading about the organs, like gallbladder. How do you look after the organs through the psychosocial control, and then nutrition-wise, you also have to look after the organ because the organ is distressed from the emotion, right? And it's not functioning very well. So you have to look after it from the nutrition point of view and also emotional point of view. Try to disperse.
Yeah. So to recap, right? What you found out was that some form of emotional stress
store in
affected the gallbladder, which then affects other parts of your body.
The gallbladder, there's one phrenic nerve from the neck
go
all the way down, and
the time I had a neck problem
and the scapular problem. That's where the refer pain from gallbladder. So there is a lot of connections from the visceral. We call it visceral osteoarticular connections. So I'm going to this. Next year I have this course taught by Jean-Pierre Barrault to learn what is the level of the spine or the osteoarticulars that's affected by the visceral. So we know like the stomach is T6, gallbladder is always the neck C4-5, liver also C4-5, shoulder, left shoulder from the stomach, right shoulder from the liver, and now it can be from kidney.
So these are like the highways of our body.
Yes, where it will affect the pain, the kind of pain, like when you have a medial side of the left knee or the knee pain, it could be from the cecum. Because we look at anatomy, the cecum are just the nerve from the lumbar plexus run under the cecum. So when the cecum are not mobile, it's pressing on the nerve. They have to pass through the cecum. So I have a lot of lady who came to me with knee pain, knee discomfort, but I said there's no pathological change in your knee, there's no swelling, there's nothing.
So when then
when we do the listening, it goes all the way to cecum. So what we do is manipulate the cecum, free up the skin from the adhesions, let the seeker move freely so they don't compress on the nerve. And the symptom gone immediately.
I mean, I was going to say, surely that cannot happen in one session. But
It happens in one session. Most of my nerve compressions case, one sessions.
But then once I leave your
it
clinic,
is lasting.
And then do I have to do?
No.
I have to do a lot of work.
No.
A physio would tell me to go home and
You-
morning when I get up, stretch.
Basically, for
Downward
visceral
dog.
manipulations, you don't. I will send you the reading about how to look after your organs through the nutrition part. Sometimes exercise that if I have a client who has a lung issue, I'll say, okay, now with the lung issue, stop smoking, like do more singing, do swimming, this kind of exercise to help the lung. Yeah, but not the physical exercise like you have to move the joint, blah, blah, blah. Not really.
I guess it's like targeted.
Targeted the organs, yes. The exercise is really for the organ, like more like a psychosocial, the whole body wellness kind of exercise sometimes. Like the young lady that I told you who I pick up has cardiac tensions. I asked her to go for singing, right? Do more walking. Let the heart release the tension. So these are more like general exercise for
because
the organs.
When I was doing my research on this as well, there's a particular sect of yoga that when you do, and because you're putting your position in somewhat, if you're stressed all the time, you tend to close up the chest.
Yes.
And if you do a lot of yoga that requires you to open up the upper side, some people actually cry. Because apparently, like, they are not used to, like, being here suddenly
Open up,
expose themselves to trauma.
Correct.
The body remembers, they remember, then it's
Yes, it is. Yeah. So my level of help is like, I'm not so much into exercise. So after I release the visceral part of the lesions, I'll say, okay, now you need to do this exercise. Maybe you have to see this yoga, pilates, you can continue to maintain the well-being of your body. Yeah. Because my specialty is to release the tension in your organs, to help you disperse the tensions, the emotional part, to help you regain the function of the organs. So when your organs function properly,
So that
you
also
can-
means that not just that if you drink a lot or if you play a lot of sport and then you get like a sudden injury or trauma, but emotionally as well. If you're very stressed at work, can you
Yes.
get like
you get
actual health problems?
Yes. Like, when you are stressed, your sympathetic nervous system, which innervate all the organs,
Right.
they literally shut down all the organs in your abdomen, reduce the blood flow, stop digesting food, the bowel don't move, you don't go to toilet, because when you are running for your life, you don't go to toilet.
Yeah, because
Right,
it's
the blood
stress
flow,
response,
yes,
the
and then
fight or flight response.
So you have more blood flow pumped to the heart, your lung are expanding more, you need more oxygen there. So the organs are least important issues when you are stressed. So now the modern day stress are work stress, like life stress, money stress, that you thought that you are managing. You are not like fighting a beast, but this kind of modern stress are hidden stress. Nobody aware.
Right. So how do our listeners?
So when the body can cope when the stress are within the threshold.
Yeah, because I definitely know a lot of people in the corporate environment and they work like 12 to 16 hours a day with very demanding clients, very demanding boss, and these are all ambitious people, and like I understand the mindset because I came from the corporate environment before as well, and like if you're not stressed, it's like you're not doing enough work.
Yeah,
and it's very
let stress drive
counterproductive.
you, Yeah.
Yeah, because when you're stressed, so you don't tend to think as well. That's what I realized. You don't tend to think more. You just want to get the job done. And sometimes you don't know whether you get the job done correctly or not, but you just want to get it done. You want to please your boss. You want to please the client.
That's why it's quite unhealthy.
Yeah. So how is it that we can like manage if, you can't take yourself out of a stressful environment? If some of our listeners probably cannot. They want to be a high achiever. They have to put in the hours and therefore they will be exposed to stress. But how do we is there a way to lower it to make it more manageable?
Well, exercise is a form of de-stressing because exercise induce serotonin that make you happy, make your organ happy. But of course, when your body can still cope with the stress, you will not have musculoskeletal system. There will no pain sign. When you suffer from pain sign, that means the body say that enough. That's enough. I need some help, right? So long as I said everyone have to learn how to manage stress. I can't tell you like you have to do this to manage stress, but everyone copes with stress differently. So sometimes when reading book can de-stress you, then you do more reading book. All right. You take your time off the work. So some people, they need to hit the gym to de-stress. Then go ahead and go to the gym. Get yourself workout. Sweat it out. So everyone is different. Everyone is different.
So you need to find a baseline of how you relax.
Correct. So like me, I used to be stressed. I work fast. I'm very fast paced. But now I learned, okay, I'm doing manual lymphatic drainage. That is a form of de-stressing. So when I do manual lymphatic drainage with my client, I cool myself down. She goes into parasympathetic mode. I also go into parasympathetic mode.
What's parasympathetic mode?
So it's parasympathetic mode is a contrast from sympathetic, right? Sympathetic innervate and make you agitated. Right. Parasympathetic is when sympathetic are decreasing, parasympathetic came out and work, and that's where parasympathetic will increase the bowel movement. And it relaxes you the whole that your heartbeat comes down, all the systems slow down. Parasympathetic is a slow down. It's a kind of night mode. Right. Sympathetic is a day mode.
Right.
Parasympathetic is a night mode. So night you relax. Day you are agitated. So we want our system to go into parasympathetic mode to de-stress. So to me, doing manual lymphatic is de-stressing. Reading a book, de-stressing. So that is my way of de-stressing. So you have to find what make you happy, what can take your job away from you. So if your body cannot cope, you can look for us. We will find out which organs that is suffering more from your stress, and we help you to release, bring down the tension so that you don't hit the threshold that create a pain or discomfort level.
Yeah, I think a lot of people today, they live with stress that, even if it's to the point of, musculoskeletal pain, they just think it's normal. It's
people live with
being
pain.
a hard worker.
Yeah, that's what I have.
I have a lot of friends who have all kinds of problems, backaches, stomach aches.
Yeah.
They can't a lot of bowel issues. Yeah, they just say it's
normal.
Body,
They go to pharmacy, they pop in some pills and thought, okay, now that's it, I cure. But no, you are just suppress the symptom. But the problem is
10
still
years
there.
from now, the problem might be even worse.
Even worse. Because you're sweeping the problem down.
I have a back ache that, comes and goes now and then.
Is it the clicking one that you told me before?
Yeah. And,
the pros, yeah.
I'll be coming to see you. Definitely.
We'll do an assessment and what is causing the imbalance in your spine. Yeah.
So you mentioned just now about energy, right? The way that you do these non-contact scans where you either scan somebody's scalp or around places where it hurts. Like a lot of people believe in this whole energy field. I guess there's two sides of the coin. Right? Some people who completely believe in it. Sometimes I feel like it's a little bit baseless that people believe in it.
It's like Qigong healing, Reiki.
Yes.
It's hard to believe.
You have also, scientific way of dealing with it.
Yeah.
Yeah, when Jean-Pierre came out with this manual thermal evaluation, he did design a thermometer that can detect the temperature of the body. So there's a research based on this one, and he did it in
it's on specific
France.
Regions,
yes, so they were doing the scan, like pick up the heat of the body, and Jean-Pierre will tell you, okay, now this is the area that will raise, and then they will come and check. Yeah, it raised. So it's really very very objective. It's not I said it's raised, but there's no measurement. He have this special thermometer that can scan the skin, and they correlate, and it was right. Whatever they pick up, it shows up in the thermometer. So that is why he came up with this book with manual thermal evaluations, and he came up with this course, and now this is what we are doing now.
What is his story though? How does he came out with this?
Well, Jean-Pierre, this is I think 46 years ago.
Right.
When he was still a physio in France, he worked in a hospital. He deal with a lot of pulmonary disorder patients. That's why he sees more than 100,000 of cases already. It's based on the numbers of clients that he sees. He came up with all this book. So what makes him learn osteopath? Because what we learn are partly from osteopath, which exists in Europe for more than 100 years ago. It's just that Jean-Pierre refined it, fine-tune it and put it into practice, reintegrate into the physio, rehab. So he make it more systematic. Yeah. So it was one particular case that he saw for back pain. He was treating the client with the normal physio technique. And then 1 week the client came back and, I'll say that the symptoms are all gone. But the client told him, no, it's not because your physio work that cure me. I went to this massage with this guy in my hometown, blah, 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 and no, it solved my back pain. It solved all the pain that I have. So that is what Jean-Pierre start thinking. What is this kind of soft tissues manipulation or massage that this patient? So from there, he learned, he picked up all this. That was 46 years ago.
Right.
Yeah. And now he is, I call it founder of this, Barol Institute.
How old is this guy now?
He's 76 and
still giving courses and
yeah,
flying all over the world.
he is so active. He's so healthy. We feel privileged to be in his class, of course. He is a very humble guy.
Right.
Till now, with 46 years of, experience, he still tell us, no one is perfect. I'm not the best therapist in the world.
Right.
I just know a little bit more to share with you, to teach you, but never stop learning. That was really, really inspiring.
Yeah.
Yes, very inspiring. So,
because it does seems like the people who are really, really good at what they do, they never stop learning. It's
Yes.
always the same story. They work tirelessly many, many years, and even when they are old, they still want to share. They still feel like there's more to learn.
Human body are very amazing. So
I think it's very underrated because for when I speak to some of my friends who are doctors, or even when I see, so I have my hand pain very, very early on in maybe 4 or 5 years ago. I went to see a specialist, and he did his standard test on nerve and this and that on my hand, because I say it's my hand, right? So he did it on my hand. He did it a bit on my neck, and then decided that my pain is phantom pain. It's psychologically driven. And he told me you're fine. Nothing is wrong with you. And I was sitting down there, I'm paying this guy 200 plus per session for consulting, right? And when I told him about what I read about, repetitive stress injury, all these things, he asked me which doctor tell you, it's a very condescending tone, which physio tell you, he don't know anything why you believe to all this, it's baseless science. And it seems like some of it's not all, but I think some of the MDs, they are very dogmatic in the sense that they just focus on what they learn. That's it.
It's very narrow.
What they learn is the best. What they learn is the scientific one.
It's correct.
Yes.
Yeah. But when they first cutting people open back in the Middle Ages, I think that they think it's hokey as well, right?
Yeah, I know.
People back then would have felt about, what? I got a cyst here and you want to cut me open and remove it? Are you nuts? Yeah. I'm pretty sure that the people back then feel the same way that we feel this therapy.
This is really, yes. Voodoo. I have one, this special client. When I first, when I first started my clinic, there was this young lady, not really young, 44-year-old. She suffered from this right neck pain for 1.5 years. She traveled everywhere. Cairo package, 8,000 plus package, physio, spent 10,000 doing MRI, and doctors find nothing. Doctors said you are fine for MRI, there's nothing. And then she was so pissed off, she demand, I don't care, I pay you so much for the scan, you have to fix me. And then what the doctor write is physiotherapy. And then she said, crap, I've done ample session of physiotherapy, nothing solved my neck pain. And she was to this extent that she really go into depression. She was mad. She can't sleep well for 1.5 years. Because you travel to Singapore, see my friend with this fantastic machine called Indiba Active. Indiba Active is a fantastic radio frequency machine. It's very good. So she have 3 sessions of Indiba Active. It really solved her pain for a while, but the pain keep coming back. Alright, it was temporarily. So when she knew that I invested in Indiba Active in my clinic, she came back to KL and looked for me. And during that particular session, I said that, let me do the assessment as what I always do, right? I do the GL, I do the LL, and I do the assessment. It brought me to the liver, and the liver was mechanical problem, and I asked her, do you have whiplash? The history of whiplash. 3, 4, 5 years ago. She said, yeah, I have 2 whiplash. 5 years ago.
2 whiplash.
Yeah, and then you have gastric dysfunction. You have gastric problem, right? Because the liver brought me to the stomach and was these 2 organs are very closely connected. say, your stomach also not doing very well. Yeah. She said, yes. When I have my stomach cramp, I really fainted. I can roll on the floor and I faint. It was so bad, excruciating pain. Wow. It has bothered her for so long. I said, okay, now for this session, trust me, I'm not going to use Indiba with you. Indiba is so much costly. I can earn so much more. But then I don't want, because it will not solve your problem. Trust me, I will not touch your neck, but I'll treat your liver. That was about 2 years ago. So what I did, I just manipulate the liver, do whatever Sean Pierre course taught me. And then she went back. 2 days later, she called me, Evelyn, I want to see you again. I said, what? You know what? For the first time in 1.5 years, my pain gone 80%. Oh, I was like, the pain gone down 80%. I said, okay, yeah, come see me in 1 week's time. And that session, I fixed her liver and the stomach. Yeah, okay, because this is the residue that I need to work on you. So after second sessions, neck pain totally gone. Stomach pain gone. And I stopped my session. By third session, I said that you can be discharged from visceral manipulation. You don't have to see me anymore, but you can continue with your yoga, your Pilates, whatever exercise that make you feel better. Yeah, because the neck pain stopped her from doing all sort of exercise. It really bothers her. So she can't do all this active exercise. Now, from now on, you can carry on with your normal exercise. And 1 month later, she called me again. I said, what's the problem? She said, I have to blame you because after you treated my liver, my mood was so good. My digestive system was so good. I put on 4 kg. Well, that is the best news. I said, that is good, isn't it? You were so skinny. Until now, she is never called me anymore. The neck pain is literally gone by third sessions. That's one of my best cases. So after that, she's a believer. She called me voodoo therapist. And I said, I'm not voodoo therapist. I'm really very scientific. It's really the nerve connections from the neck to the liver are very, it's scientific.
I mean, do you get hate from
other competitors?
Like traditional doctors and...
I don't challenge.
I put air quotes, scientific doctors, right?
Yeah.
Do you ever get hate or do they pass comments?
No. I'm not very high profile. I don't go out and challenge all of these doctors. Yeah. But I do remember, I have attended one VM4 class, the thorax class in Taiwan. And one of the therapists overpressed my pericardium. We will learn how to treat the heart, right? And this manipulation, I think he was a little bit over. And after the course, I came back to KL with tachycardia. Right? My heart was beeping, it can beat, skip 2 beats and beat faster. Whoa. It was I said, this is unusual. And after a few days, I had started having scapular pain. Was kind of pulling pain. I don't remember doing any kind of exercise that can cause a pulling in my scapula. I was like, and what I can recall is that maybe it's the technique, but I can't confirm. So I went to see this cardiologist. I said, I better have my heart checked, ECG, blah, blah, maybe, I'm 48-year-old, who knows, that I might have heart problem. And when I talked, and when this doctor do the ECG, everything was normal. And I brought this up to doctor. Doctor, do you think that, I attended this course, that treat the heart, from a ligament. Do you think that is because of the over-compressing of this ligament that, causes pain? And then the cardiologist look at me. Heart has no ligament. And then from then on, I better shut down because this doctor will not accept whatever I try to explain. Because pericardium are the pouch that cover the heart and it was attached to the sternum. From the anatomy point of view, there are 3 ligaments that hold the pouch where the heart are pumping inside. Oh. So luckily, after 1 week, I went to Singapore for another course with my mentor, right, from Sydney. He is a guru in this area. I told him, can you fix me? I think I have some scapular problem and my heart was not doing very well. The pain was bothering me a lot. And within 1 session, the tachycardia, I still have the tachycardia, it was kind of slow down. It was really calm. My heartbeat become normal. My scapular pain is still there for that afternoon. I went home, but the next morning, I tell you what, my scapular pain all gone. Yeah, it was like 100% till now. So that is when you are precise, when you know what causes the pain, you can really do it within 1 session. And I'm the patient, so I know I believe in this technique because I got treated with this kind of special technique.
Wow.
It's amazing. I can really feel it.
Our bodies are really delicate as well. Huh?
Body very delicate, and the system we are connected from head to toes. So even if you move the little toes, you can see the membrane move.
Which is what they always talk about, reflexology, and you get these pictures, right, of your feet.
Yes,
and all the different parts. Yeah.
Now before that I don't believe. Now I believe. Yeah, now I believe.
And
You don't know. You don't.
much,
Yes. But we cannot condemn a technique just because you don't understand it. So last time I'm quite skeptical. I'm a Chinese, but I don't believe in acupuncture, all this meridian. But after I learned this one, I will say that I have to be more open. Who knows? This professional, they know what they are doing.
I was going to get to that actually.
Yeah.
Do you, because in a way, right, if I put it simply, this is almost like a massage.
Or we cannot call it massages, like soft tissue manipulations.
It's very
So
different.
whereby
It's
there is
very-
contact,
massage is
with parts of your body. Do you think there is
We don't
you
do-
find a lot of cultures that have people just like Jean-Pierre, right?
Yeah.
Who heard about this man who went for a massage.
Yes.
Do you think that there are cultures or there are masseuses who actually are doing VM without actually knowing that they are doing?
Yeah, I believe so. It's just that they are not known.
Yeah.
Like even the Chinese physicians, like all this technique, like for us, visceral manipulation therapists, we may pick up the course together, but not all of us have the same level of skill. Like the physio, we graduate from the same school, but not everyone are the top physiotherapists. No, it depends on how much you practice, how much you pick up the technique. So like acupuncturists, there are good acupuncturists, there are bad acupuncturists. So we cannot condemn all of them just because that we met one bad acupuncturist. So like a physio, they are good physio, really they are good physio, they are good doctors. So I'm more open now. When my client said, "Oh, I met this doctor," I said, if it cure you, if you see positive sign after you see the doctor, go ahead, continue. Because I don't know what he's doing on you, and
Yeah, I think this is a very brave thing to say. Because
receptive.
I think a lot of people would think that if I go to a chiro, he knows everything, and this is the missing link, and therefore he should solve my problem. I think a lot of people go with that line of thought.
No, yeah.
Yeah.
But no one knows everything.
Yeah, no one knows everything, it seems. Yeah, because from my experience as well, trying to fix my muscular problem, that I've been to so many different physios, so many different chiros, spent so much money, and different things work at different times.
Yes.
Strangely. Then I don't know, because I see a lot of physios that fix certain part of my body. And then I obviously saw Lydia, who has a very huge influence on how I look at my own body, and I did Pilates. And then Gan also has a very strong influence on how I articulate my body when I sit, when I stand, when I walk. And I'm meeting you as well, give me a different perspective on how that connection to the organ work. And it's crazy because the more I think about it, the more I feel it. The more I can feel like when I tense, I know that my lung capacity suddenly goes down.
Yes.
And I'm not drawing a lot. And the moment I just want to distress, I take a lot of deep breath just to push the capacity out, and then the heart slow down, and then I'll just think of a relaxing time.
Try to calm.
Yeah, I try to go back to a place where I feel super relaxed. So recently I did this flotation tank thing, and in that 1 liter hour, I felt so relaxed. All of the stress just washed out, and you kind of collapse, but it's a nice little collapse. You just
That's one of the good way that to help
so
your
you
system.
build a baseline, and when I get stressed, I just mentally bring myself back there, and just I think I feel okay, my stomach a bit let go a bit. I breathe a little more. I don't hold so much tension.
Yeah, I think the recent course we have this our special instructor from France, PFA. I brought in one lady who has a lot of pain on the right side of the body. I asked the PFA to do a demo on this client for us. And in his assessment, the symptoms shows are all on the right side. But the problem are from pericardium. And it was on the left side. That pulls the lung, that pulls everything to the left. And this was, the symptom shows on the right side. And then when Pierre said that, okay, now, after assessment, Pierre said, okay, now, there are few things that she needs to fix. First thing, the spine. The heart frame. Next, neuromeningeal. Third, visceral manipulations. After that, go back to neuromeningeal. So, all of these 4 techniques that she needs, I can only manage 3. So the first one, spine, I don't do spine manipulations. So that's why I said, for some client, you might need more than 2 professionals to help her.
Right.
Unless you know all these 4 techniques like PAV. He knows how to crack the spine.
Years.
26 years of practice.
Right.
So if you know all these 4 techniques, you can manipulate. You can help the client. But for me, I don't manage spine. I do soft tissue. I do visceral. So if my client comes to me like the previously I mentioned about this boy who has scoliosis with the lung tensions. What I did within 1 session, I settled all the lung tensions, right? And I said that you're done. There's nothing more that can help you. I refer you to a specialist, a physio who knows how to do scoliosis treatment, who knows how to do exercise for scoliosis. That's where you need to work with him. Because muscle imbalance through all this, I'm not trained, right? You have to fix it. I fix you internally. I solve the tensions that pulls your spine. Because if you go to that physio, you might need to spend 20 sessions. Like with me, releasing the tension from the lung, you may only need 10 sessions with him. So it makes your rehab easier. So it's a teamwork. I always said.
As you go along learning, how many VMs are there to?
Oh, right.
How many modules?
Wow, there's a lot more. A lot more. Well, the total level for VM is VM 1, 2, 3, 4, 5, 6. And there are visceral vascular technique. Where we need to work with the vascular system. And there are manual articular spine, manual articular joints, upper limb joint, lower limb joint. If you want to do the manipulation for the spine, you will pick up the course.
Right.
But for me, I just wanted to finish all my VM 1, 2, 3, 4, 5, 6 and vascular course. I attended vascular course for the upper limb, so I know how to deal with the carotid tensions. So some people, they have a headache because of the blood flow issues. We have to assess all this. We have to assess the blood vessels. Those blood vessels, nerve, they are just neighbor together. They are in one fascia system. So sometimes we manipulate the vascular. We also have influence on the nerve.
Right.
Yeah. So that is what we cannot just deal with visceral. At times we have to work with nerve. Like for your technique, I use neuromeningeal technique. I use visceral technique.
Right.
Yeah. This is the 2 major techniques I work on.
Okay. So depending on what kind of background the student is from, they might need different, like you learn VM. If you're a chiro, then maybe you don't need the spine one because you might have some.
Yeah, overseas, a lot of chiro, they came for the course. Right. So the chiro, they have all this technique, right? It is also misleading into their practice. If the chiro just crack the spine without releasing the tension from the organs, the client will crawl back with a stiff spine. Because what pulls me is still pulling me.
But don't they teach all this in medical school? Shouldn't they teach all this in medical school?
No. It's very basic.
Visceral manipulation.
But I think some in future it could be incorporated in the school. But
I know it's 40+-year-old. Is this considered very young in medical terms? Like Barao Institute. What VM is teaching, is this very young in terms of like medical science?
I'll say that it's not young, like 46 years of practice. You know, like in US, you look at the numbers, there are more than 4,000 practitioners are doing the VM.
What about here in Malaysia?
Well, me and my partner are the one who are more, we complete VM5. The rest, there are 2 more, 3 more up to VM4. But what I understand is that they learn, but they don't feel comfortable practicing it. Because as a physio,
less than 10 in Malaysia.
It's less than 10. Definitely less than 10. Like, those that really actively practicing it, me and my friends in JB, all my clients come in, head touch. All my client knows, head touch. But when I ask my friend, do you do head touch? Do you do the cranial assessment? They don't feel comfortable doing that. Because they said that physio are all scientific, all joint, all of them. So once they put the hands on the head, the patient will start querying, what are you doing? Like first, when I first practiced on my mom, I put my hands on my mom. My mom said that, are you giving me energy? I said, no, I'm feeling the fascia. I have to spend 5-10 minutes to explain what I'm doing.
And it's difficult. This is the barrier that we need to break because it's still seen as like pseudoscience.
Yes, pseudoscience. A lot of I have this.
That's a good word.
I have this client who came to me for back pain. After the treatment, he came to me for back pain and leg spasm. He said that he have to have Acosia every night to put him to sleep because of the pain was so troubling. He came for our Indiba Active, right? He thought that Indiba Active can solve the problem. I said, same thing. After assessment, I said, no, this one won't solve your problem because your problem comes from the abdomen, comes from the sigmoid and the nerve, obturator nerve that's compressed. So what I do is a really light touch, manipulate the sigmoid, do the nerve gliding. The nerve are very sensitive, so the touch is really light. So I apparently do a very light technique on him. And he is, middle-aged Chinese man. He went back, he told me 2 days later, he came for the came to visit my friend who happened to know me. He told my friend, that day I went back feeling cheated. I wanted to use the machine. Like she didn't use the machine on me. She just, you just light touch playing around with my abdomen, and then she charged me for doing nothing.
Yeah.
And he said that he felt cheated. But 2 days later, he came back, he went back, he told my friend, you know what, I don't know what happened that night. Whether it's psychological problem or just placebo effect. For that night, I don't need medication and I don't feel spasm.
Whoa.
I sleep so well without pain. And 1 week later, he came back. He said that whatever you did on me, continue.
Right.
I feel so good after the first session. And I said, you don't have that problem anymore. Why not? I do the session, the sigmoid is good, the colon is good, the nerve is fine. If there's painless, you don't need to see me anymore. So I discharged him by the second sessions. And he's so happy. He's really happy. And then, he brought his friend and said, okay, I bring you to this, in Chinese called San Yi, like it's San Yi.
San Yi,
I know, like the voodoo therapy, something like that.
yeah.
But I told him we are not. It's a magical healer.
Like a bomo.
So if I
Bomo
can,
healing.
so a middle-aged Chinese man, I can, he can start believing in me. What's up, magic?
Yeah, but I can understand this though, because like I think physios will be so hesitant, like you're so scared.
It's so scared, yes. I like trying to do something that is different from my practice.
Especially like when they have their practice for a very, very long time and then suddenly they do this and then their client are freaking out, feel cheated. That's the worst feeling.
It's the worst feeling. I know. That's why I try to tell the physio, you are your own barrier. If you believe in yourself, if you believe in the technique, you will know how to explain to the client. Like when I first do this, first few sessions, I also feel doubtful. When my client don't come back after one session, I will always ask myself, is it that I'm doing wrong or they don't believe in me or I'm not good enough? They stop coming to see me. So I bring up my courage. I call them, I text them. So, how do you feel? And most of them say, I'm fine. I'm painless. I don't need to see you. Then I said, at least feedback so that I know you are well. And then it's not
so it
that.
gives you the confidence.
As well need that
So the
validation.
first 1 or 2 years, I really struggled with my confidence.
Right.
After more feedback, after, all this, I know I'm doing the right thing. I know, my skill level is up. So I opened my clinic only after 3 years of practice of learning all this.
Oh.
I studied for 3 years, really.
Also, you had no income for that 3 years then?
I still, I'm a neurotherapist, right? So I do freelance a little bit. I have savings
Wow, that's really brave. That's just really
it's
brave.
very
3 years.
Yeah. Because I myself can't get my client to pay me for experimental therapy.
Definitely.
I don't feel good. So I only practice for my friends, with my friends, family.
Oh, I wish I knew that.
Go to attend more courses, get feedback from the training. It's a tough journey. It's a tough. I can understand why a lot of therapists they don't come for the courses. I try to urge, encourage them to join me for the courses. And the first thing they say is very expensive.
How much
so
is
many
it exactly?
levels. All right.
Like
4
VM1.
days. Like VM1, 4 days. We count by days. 4 days is about full rate is 4,200. Early bird is 3,008. Because we have to pay the US instructor fees and all the, you know, like, the commitment is high.
There's an exam at the end of the course.
No. Is there unless you want to be fully certified as a visceral manipulation therapist.
So you have to finish from VM1 to 5.
6. VM1 to 6, and then go for the theory test and go for the practical test in US.
Right.
Only then you are fully certified. If not, with your physio certificate, you can still practice VM.
Right.
You're just a physio with visceral manipulation skill. But you are not a certified visceral manipulation therapist.
So how much is it? Like if a physio one, like after 1 to 6, you know, they're convinced I want to do it, how much do they have to prepare, and how long would the course take for them?
No, if you are crazy enough, you can finish the course within 1 year. I met one Indian physiotherapist who finished most of the courses, like 11 courses in 3 months' time.
Whoa.
He become a PR in Singapore because he completed most of the courses in Singapore. I said, how can you digest all this? Right? And he said that, I just want to finish all this so that I have enough time to practice all the technique. Yeah, everyone have different kind of learning capacity or different style, right? For me, I complete Visceral 1, 2, 3, 4 within 2 years. Alright, and then it took me the 3rd year to pick up VM5 because we have to have time to practice the assisting skill. So it will at least take 5 years for a normal therapist. If your funding is really limited, 1 year can only take 1 course kind of thing. Like it will really take you 5 to 6 years to complete the whole VM. But I told the junior physio, VM 1, 2, 3, 4 is the core you need. You need to finish VM 1, 2, 3, 4 for you to understand the technique. Because you can't just, when you do GL, if the GL is generally saying bring you to thorax, you only learn abdomen and pelvic. You can't treat whatever that you pick up in the thorax.
Yeah.
So that's why I say that learn VM 1 to 4 and you practice. You don't have to go for VM 5 because VM 5 is more like emotional.
Right.
It's more, and it's just another tools to enhance your listening, enhance your treatment. But if you go for the physical part, you still can do a lot more than those therapists that's not learning VM.
But I digress. I think physios you're listening, do all 6, man. Because the emotional part is really interesting. Like when I did it, I was like, whoa, like.
I'm waiting for my VM6.
Yeah.
I'm trying. Yeah, like my mentor, he can pick up. You know, this woman, 15 years ago, she has problem. Tell her. Ask her.
I'll definitely come in again. Like,
you know, like he's so fast because he learned VM6. Because VM6 is 4 full days. 4 full days teach you how to do the brain dialogue.
So
how to pick up the emotional, very focused.
Right.
So when he put his hands on the client, within seconds, he know.
Can't hide from the guy.
Yes.
Can't hide from the guy.
Yeah.
If his wife cheated on him, like, can you tell?
No, that's a joke. That's a joke during the course. That's a joke. In a VM5, our instructor told our I don't know whether this one will go to Jean-Pierre or not. Sorry if Jean-Pierre listen. Jean-Pierre will do this on his girlfriend. He will do the scanning. He will check whether she is in love. You know, like when you are in love, the projection on your breast and the ovary, they will have the heat. He'll do the scan on his girlfriend. That's a joke that our instructor told me. So yes. Imagine in the course. I have a sad news. My best friend who always attended course with me. One day before the VM5, she was diagnosed with a cecum cancer. Right. And during the course, we were doing all these thermal evaluations. And in the class, there are about 40 therapists, 36 to 40 therapists. We have to change partner, like everyone do the scanning on each other. I tell you, only me know her problems. I know that she has cecum cancer, right? But no one knows. But those that are good, those therapists that do the scanning on her, pick up the problem in her cecum. They all point at the cecum and say, there is something here. So it's science, right? How to explain that your stranger who doesn't know you can pick up the problem in you? And I pick up, there's one old physio, 80-year-old physio, whom I pick up a lesion in her left knee. And she said, 2 weeks ago I had a fall on my left knee. I said, there's a abnormal hit on your left knee. Well, that is very, we call it, it strengthened my belief in this course. The more I want to pursue, because of the feedback from the counterpart and my friend's case really pushed me on.
Does it get like too much? Ever too much? Because, like how you said it, so right? Something in your stomach can affect that, that. It can be like, you can be lost in the woods and you don't know which way to go.
No. Our body will go to the biggest lesions. Right? It can be the the main one. So when we do the head touch, we are directed to the area that has the biggest tension. You might have multiple area, you might have multiple problem, but we always go to the big, we call it taikor, the one that influenced the others. So we have the test, we have the inhibition test. When we pick up 4 points, we will go, try to inhibit this one, try to find which is the point that affect the rest. And we always go to 1 and 2. So in that particular session, we only treat the main one.
Right.
So we ask the client to come back 2 or 3 weeks later. When I settle this biggest knob, the tension, the whole body will realign. All right? And then you might pick up the second layer. So we don't see you immediately the second day because our body will need time to adjust. So sometimes the case as I told you, I need 6 sessions to treat her problem because she has 6 multiple layers. She has 6 problems that I need to deal with to finally get to the root cause.
6 to 12 weeks, depending on how her body feels.
Yes, something like that. So, and then after the 6th session, completely healed. Till now, no problem. It was amazing journey. Like my client was like, how come you can't solve? Yeah, but I still need 1 or 2 sessions more. But the best one is one lady who was referred to me by a physio, can't treat the problem. She has a lot of abdomen pain. This lady is a young lady, about 30. So she came to me, a very skinny lady. I do the assessment. She was wearing her pants and my hands was drawn to the pelvic region. I told her, there is something here. Can you pull down your pants? Very strong pull on the right side of the pelvic. And I pulled down, there was a scar. There was a uterus scar because she has cesarean. So when I do the test locally, I found that the scar, after the operations, they cut through the scar, they cut through 9 layers because from the skin going all the way down to the uterus, there are so many layers. And the operations left a big scar that twists her uterus. So her uterus was inverted to the right side. And it caused a lot of pulling. And it changed the way that the sacrum move. Because there are a lot of fascia systems that connect from a visceral to the spine. So within that session, I release the scar, I get the uterus to move back properly in relation with the sacrum. And then when I prone her, I found a lesion in the coccyx bone. I told her, this kind of coccyx dysfunction will always lead to headache. She didn't tell me that she has headache. I asked this lady, do you happen to have headache? She said, yeah, I have massive headache, but I never know that you can treat headache. I said, maybe I'm not treating headache, but I'll treat your coccyx bone, right? I'll treat whatever I find. I don't know you have headache, but whatever it is, I just treat your dysfunction, right? That's why I don't treat your pain. I treat what causes the pain. So 1 week later, she came back. She said that totally pain-free from head to toes, her abdomen discomfort, back pain, headache, all gone. 1 session. That is one of my best results. I'm so happy with this girl. She also bothered her for one year.
1 year.
Yeah, also because after cesarean, and one more thing. She said that other than that, her menstruations come back. Her menstruations stopped for almost 2 years.
Wow.
Yeah, yes. You know, because when your uterus are not in the right alignment, it affects the ovary. Right. All right. It affects the hormone system. Yeah. Whoa. Yeah, visceral manipulations not only change the pain, it correct the functions, like it also change the pituitary, so it change the hormone. Yeah, menstruations problem. It can bring back the menstruations. Like I have when I was practicing VM, I have an NM1. It was a taught in the NM1. I applied this on one lady who has headache, and the listening bring me to the head, the cranial. So I just do as I was taught. I do manipulate the frontal lobe, And then 2 weeks later, she told me, you know what? my menstruation stopped 10 months ago. I thought that I was menopause. She was 42-year-old, right? She came to me with headache. I also helped her with headache. But she said, after that, after you manipulate my head, my headache was gone and my menstruations come back. Because the frontal lobe compressed, if it's not moving, it affects the pituitary gland that sits right under it.
Wow.
So when I free up the bone, I free up the compression from the pituitary. So the pituitary start functioning.
Right.
So the hormone become normal. It re-regulated. So
there's space to...
there's space to move. So I call myself more like a wellness therapist now. So I'm not only dealing with your pain, but I bring back the quality of life and I bring back the overall health system. I balance your body.
Like, even though I know this coming into this podcast, my mind is still blown.
I'm still figuring, how
again.
much I can do. I'm still figuring.
Close to being speechless.
It is, but when you look at the anatomy, we are doing what the body is supposed. It's really scientific. It's really based on science.
And it gives me a little bit comfort to know that our bodies are amazing.
Yeah.
Every little thing will have an effect just because every little thing has a role to play.
Every little thing. But we cannot cure organic issues. Like, I cannot cure cancer. A lot of people that, can you cure cancer? No, I can't cure cancer. Right? But I can make your body maybe feel better. Right. Like stronger. Like when my uncle has cancer, he was doing chemo, I will visit him. I said that I can't do anything active on you, but I can help your digestive system to be better, to deal with the chemo. I can do motility.
Yes,
correct. And your body is stronger. You don't have all this side effect from the chemo.
Right.
So we are just a support staff, right? I support your body to heal itself. I try to give it to nudge it into a right alignment, so that they start adjusting.
This may be like, far-fetched question, but do you think there's any link between being spiritual also as well as believing in this?
I'm still a therapist. Spiritual wise, I don't really believe it. I can't
on a personal level as well.
On the person,
are you religious or spiritual?
Not really. I'm Buddhist, but I'm not really a practicing Buddhist.
Okay.
Before I'm quite skeptical, but now I will be more open. I understand that just because that I don't know doesn't mean that it is not exist.
Right.
So I'm more open to all this now.
Right.
But to me, I am still a very grounded therapist. I look at things very scientifically. Even like the manual thermal evaluation is scientific because you can pick up the heat. Our hands are trained. You can be trained. Like, why a wine taster can taste the wine from they can tell you what age is this. So, because all this sensory, it can be trained.
That's a good
example.
anecdote,
How can you tell a wine taster smell? You can smell something that I can smell. Because you train. Yes. Like
I think there's some...
So we have to be more open to all this now. Yeah.
I think there's some evidence I read before, like if you do meditation and like your brain falls into this delta wave and you get some healing benefit as well. And some monks can control their body temperature. And there's a guy who did it, Wim Hof.
Yeah.
So we hope to get the other guy in.
I was going to bring that up as well.
Yeah.
Because this guy, Wim Hof, is basically some guy who has a breathing technique, right?
Yeah, he basically say he floods his body with oxygen. And he trained himself so much that he can control his... So what he did is that he can control his body temperature to the point where he can swim in the Arctic, run just with a boxer, I think. In snow, barefooted on snow, no problem.
I guess my old body thing is really powerful. Really. Mine can affect the body, like emotion can affect the organs. Like, I believe that this guy can do it. Just with training.
And there's facts as well. It's not just like hearsay. He actually, like, they put in, he said he can control his immune system, his endocrine system, his everything. And they put in E. coli into him. And to a bunch of other people as well. And because he's trained, right? So they say they can actually see the blood. Actually, they can see the antibody fighting the E. coli the moment you enter the system. But other people get sick.
Yeah.
So we have a guy in Malaysia who apparently did this certification, so we are hoping to get him on here. But coming back to us, how long are we on the podcast already?
I think we.
Yeah.
2 hours.
Yes. Yeah.
Time, right?
Correct.
Yeah. So maybe we can tell us a bit like how can physios who are interested, who maybe they hear this, they're interested, where can they find more resource, and how they can they sign up? Is there any like a financial package? Do the government support this? Are you trying to get
it's a very sad thing is that I guess getting approval from HRDF is not easy,
right?
Because there's a lot of process, and one of the HRDF criteria is that you must have a full-time teacher in the local, but none of us are qualified to be a teacher,
right?
So with this kind of criteria, it really put me off. I really don't know how to apply for the HRDF,
right?
Of course, with HRDF, I have one physio who is a head of department in Penang Hospital. She urged me to apply for HRDF so that she can send more staff for VM courses. She is a believer in VM because she's the only one that's trained in VM 1, 2, 3, 4 in Penang.
I see.
But because of funding issue, she can't send her staff. And also, like coming with a hard, solid cash of 3,000 plus is not easy for the
and
private.
there's only one VM course. You gotta do like 6 of them.
At least 4, but kind of like close to 20,000. Close to 20,000, right?
Including traveling.
But at least it's cheaper to attend in Malaysia, right? You save the cost of traveling. Like, if you look at the rate in Sydney, the accommodations and all this.
So we can only wait for you to be a teacher.
I can never be a teacher. Now it will take at least 20 years of practice to. All our teacher, you look at their history of practice.
Right.
At least 10 years and above.
Right.
To be qualified as a teacher, to be trained by Baral and qualified for level 1, level 2, level 3, level. So in Baral, so you can see there are not many high level teachers. It's that and. There are less than 30 teachers.
Because it takes a long time to get there.
So
it's very rigorous.
Yes, it's not easy to be a teacher. But the teacher has to be good. So when I organize the course, I make sure that I bring in the good teacher, that the local therapists will appreciate that they can teach very well.
But where can this physio, whoever that's interested, where can they find you?
They can go to the website, the FN Harmony.
FN Harmony.
FNharmony.com.my.
Okay.
Or you can just Google visceral manipulation. I think you can find us.
Okay, maybe you can give us a link so we can post it in our video as well to help people find it. Yeah. And this book? Do you want to talk a bit?
This book is Understanding the Message of Your Body. I encourage my client to read so that they have a better understanding of their organs. So when I pick up gallbladder, right? I have a summary that I can send to my client, but if you want to know in detail what it works and how you can do what you can do to help your organs, it talks about the nutrition's help, psychosocial help, and exercise, and why you are suffering from these dysfunctions. This is a good book. This is just 90 ringgit.
And this was written by
the Jean-Pierre Barral. I am reading,
started this whole
VM thing.
Before I pick up VM, I read this book.
Right.
And after that, I lent it to one of my friends who travel around with this book and never return. And they find it so interesting, they pass on to everyone.
Yeah.
Yes. And this is, you understand your body and it helps you to deal with it better.
Right.
Because I can only help you with certain part. When you have a really organs dysfunction, I release it. Right? But I need you to go back and read it and try to face your problem to prevent it from relapsing. Yeah? It may come back if you don't face the problem. If you don't try to resolve your issue, the emotional issue, your nutrition issues, the physical issues. Yeah, sedentary lifestyle. Shomel always says sedentary lifestyle is not bad, not good. Yeah, abusing your body through alcohol also no good. He also against cold drink because it really spasm up your stomach.
Oh, really?
And your left kidney just lie beneath your stomach. So there are some saying very relate to my grandmother saying no cold drink.
Yeah,
now after VM, I understand why no cold drink. It really frees up your left kidney, and your left kidney linked to your urogenital problem. Left kidney is the sexual kidney because the blood flow from the urogenital goes to the left kidney. So if left kidney are dysfunction, it affects your urogenital problem. Like
What I'm
manhood.
hearing right now is just like,
Right.
don't drink cold beer.
Try not to. Yes, try not to if you really want warm yourself up. Yeah, that is there. So I stopped drinking cold drink because I'm age catching up. When you're young, you may want to. You still have the no.
No, not really. I feel it now. I'm already 30. I feel it. I definitely feel it over this weekend.
Yeah. So yeah.
All the drinking.
There are a lot of theory really helpful. Yeah.
Right. Okay.
Okay, I am, you know.
Yeah, if you want to know more, you can go to the Google visceral manipulation. There is ample message and theory about all this.
Yeah, I feel I've been mind blown over the last 1.5 hours.
Yeah, 1.5 hours we did.
Yeah.
Wow.
Almost 2 hours.
Almost 2 hours. Really, wow.
Quick. Yeah, I mean, it's
that went fast. Yeah,
there's so much. Yeah, there are a
and
lot.
I feel like you have more to share. I really feel like you have more.
but then I hope to share with the practitioners. Really come, let the practitioner come and learn so that more patients can benefit, because it is a brand new world, and we have for future rehab therapists. Is going to be very helpful for our for the healthcare industry. So the patient don't keep paying for nothing.
I hope some of the MOF or MOH guy are listening, so we can maybe make it easier for us to learn this. And
I guess when there's more people learning about it, like there's more, for example, physios in Malaysia who subscribe to this and start practicing it. The demand will also be there.
Yeah. And then Taiwan therapists, they are really crazy for this course. And then when the course open up for registrations, within minutes they sign up. Yes, because they are endorsed by the Physio Associations of Taiwan. And even one hospital in, I think, university in Thailand, they bring in the course for their therapists. So next year they are starting to train their own therapists with the VM.
Wow.
Yeah. So
like
if all this medical line, they are doing that in overseas. We hope that Malaysia will catch up soon. Yeah.
We hope so too.
Yeah.
I hope so too.
Malaysia baru, come on.
Yes, Malaysia, yes.
Catch up. Okay. So it's been such a pleasure. It's been a great 2 hours. It's been very educational for us.
Thank
you.
And
I really like having you on again soon, hopefully.
Sure, that maybe I can get my instructors to come and share his next will be Eric Mullin. Eric is a great instructor. Yeah, who wrote the book about fight the epidemic stress. Yeah, stress epidemic.
Oh, that would be great. That would be great for all
the problem is
people.
English might be a little bit limited. You can. I'll try to invite him over. Yeah, it'll be good to get him on board. Yeah.
Fantastic.
With my mentor, who I told you he can pick up tumor in the liver, that was blown my mind. Yeah, he can share with you.
Definitely coming for a session sometime.
Yes. It will be next year. Next year, they will be here in February because we are having a course level 2.
Okay.
Yeah.
All right. We're done.
Okay.
Good night, folks.
Thanks, guys.
Thank you.
Okay.
Thank you for listening.
Right.
Thanks.
Bye.
Signing off.
Okay.